when I was seated with people who still felt suicidal, and I look into their eyes were screaming at me, even though they were like this, but their eyes were screaming at me, "You're checking boxes and I'm running out of time." So
Wow.
I had a choice to check boxes, which is what I would have had to do if I was in a clinic, or go where their eyes took me. So I stopped checking boxes and I let their eyes take me into the dark night of the soul, which is where they were stuck. And so one of the things I learned about people who are feeling highly suicidal, and you wouldn't understand this unless you have felt suicidal, but death is very compassionate to psychological pain that won't go away. When you feel hopeless, worthless, and that life is useless, death can take away that pain. It's like the sirens calling the sailors in mythology onto the rocks, and so what happens is when people feel pain like that won't go away, they grab on to thinking, if worse comes to worse, I can always kill myself. And what will happen is they will secretly keep that as something they can do. They won't talk about it because they don't want to scare their families, or they don't want people to throw them in the hospital every time they think about it. But they'll keep it as a way to get rid of the pain. But unfortunately, as my mentor, Dr. Ed Schneidman, the suicide expert, used to say, he said, suicide is a permanent solution to a temporary problem. Suicide is a permanent solution to a temporary problem. And so what I learned is that suicide felt their pain, and I developed this ability to go in and feel their feelings with them. So surgical empathy is going in, and when people feel that you feel their feelings, they might let go of being suicidal and grab on to your empathy. So I'll give you one very special story that really proved this to me. There was a woman I was seeing that Dr. Schneidman had referred to me. I'll call her Nancy. That's not her name. And she had made several suicide attempts in the years before I saw her. She'd been in the hospital a month, 2 months at a time before I saw her, because way back then, people could be in the hospital for a long time. I mean, it's different now. And I didn't think I was helping her. And I was seeing her for about 6 months, and she never made eye contact. So if you're me, this is Nancy. So, and I didn't think I was helping her. And in those days, once a month, I would work in a psychiatric hospital covering for the other doctors. And sometimes you don't sleep for 24 hours. And when you don't sleep for 24 hours, things happen to your body and your mind, because you're sleep deprived. And so I hadn't slept for 24 hours. And on a Monday, I come into my office and there's Nancy. And she has the same look as she always does, where I'm looking at her and she's looking away. And as I was looking at her, all the color in the room turned to black and white. So I'm looking at her and the room is black and white. And then I felt very cold, and I thought I was having a stroke or a seizure. And I'm a medical doctor, so I'm a psychiatrist, not a psychologist. So I did an exam on myself to see if I was having a stroke or a seizure. I put my finger out to see if I was seeing double. I tapped my knees, I tapped my elbows to see if I was having a stroke or a seizure, and everything was fine. And I realized I wasn't having a stroke or a seizure. And then I had this crazy idea that I was feeling what she felt.
Oh, okay.
And so, seeing the world as black and white and cold is what I had this crazy idea that this is what she felt. And because I was sleep deprived, I said this to her, Pratham. I said, Nancy, I didn't know it was so bad, and I can't help you kill yourself.
Okay.
But if you do, I will still think well of you. I'll miss you. And maybe I'll understand why you had to get out of the pain. And I thought to myself, I'm in real trouble. I just gave her permission to kill herself. And I thought, I can't believe I said that. And that was the first time that she looked at me. And I thought she was going to say, thank you. Thank you for understanding. I'm long overdue. It's time for me to do it again. So I thought I was in real trouble. And I said, what are you thinking? And then she looked right at me like I'm looking at you. And she said, if you can really understand why I might have to kill myself to get out of the pain, maybe I won't need to.